Almost all of us have been there. It's itching, it hurts, it can even bleed, and it's in the anus. This, which you can see here, is a cross-section of the anus. This would be an internal hemorrhoid, and this over here, an external hemorrhoid. Actually, everybody has hemorrhoids. And why am I saying this? Well, because hemorrhoids are normal anatomical vascular structures that everyone has. They can be found over here, and they are small cushions that help control the stool. These hemorrhoids can become swollen, and then we refer to them as internal hemorrhoids. A disease, internal hemorrhoids. Here we see the perineal vessels, and they can become thrombosed, and we refer to that as external hemorrhoids. So this is what patients usually get wrong. Internal hemorrhoids are actually normal anatomical structures that became swollen. The external hemorrhoids are not hemorrhoids at all. Those are perianal vessels that became thrombosed. Luckily, not all of us experience hemorrhoids that are swollen or thrombosed perianal vessels. But 2 out of 3 individuals of general population actually do have this disease. It's rather common. How and why exactly they happen, we don't know. What we do know, however, is that constipation, diarrhea, pregnancy, and sitting on the toilet for too long does increase the risk of having hemorrhoids, or simply it makes them worse. So what can be done about this condition, and what are our options? Well, there are many options and many suggested treatments which actually do not work. Flavonoids are often suggested as this successful miracle treatment, but the benefits are questionable, and there are potential side effects. Chinese herbal treatments were not proven successful in clinical studies either, and the steroids, which actually do help, can only be used for 14 days. This is the case because steroids are associated with thinning of the skin. So what can be done about these hemorrhoids? Well, there are 4 things I'd like to highlight, and because it can be extremely frustrating if you tried some of these previously mentioned treatments and they didn't work. I guess the first thing I should suggest is to listen to doctors who follow evidence-based medicine and adhere to the guidelines usually created by the relevant American societies for medicine. For example, the American Society of Colon and Rectal Surgeons does not recommend the use of topical agents and suppositories. And I don't know why across America, but also around the world, doctors keep suggesting treatments like that simply don't work. The second thing that can be done is to subscribe to our channel and like this video, because YouTube and other platforms will not suggest this video to other people suffering from hemorrhoids unless we get enough likes and subscriptions. That's simply how their algorithms work these days, so that's something you can do to help us help other people. And now let's explain the third thing that can be done, and that is to understand that treatment of hemorrhoids consists of a teamwork between a patient and a physician. And what patients can do about hemorrhoids is simply to eliminate the causes of hemorrhoids that we identified. Not the causes, but the risk factors. First and foremost, diet is important, with a lot of water and fiber. After that, it is important to treat diarrhea and obstipation if it's present, and not to spend a lot of time on the toilet or straining. Concerning the pain, patients can take non-steroidal anti-inflammatory drugs without a prescription. That is, if they don't have any other contraindications. Doctors, however, concerning the pain, can prescribe local anesthetics such as lidocaine. But to cure hemorrhoids, doctors can perform a procedure called rubber band ligation. This procedure has some potential side effects such as pain, bleeding, and inflammation. Rubber band ligation is actually a first-line treatment for grade 1 to 3, and this is actually a good way to treat this condition because it has a cure rate of up to 87% and a complication rate of up to just 3%. This is where skills and knowledge of a doctor can help solve the problems for the patient. This is not just some pill you prescribe. It is a procedure in which an operating surgeon and his skills have a direct impact on the success rate and the outcome of the procedure. Another successful treatment for hemorrhoids is a treatment with a success rate of up to 70%, and it is called sclerotherapy. It involves an injection of a sclerosing agent. There are also cauterization methods, and this is what evidence-based medicine suggests and recommends. This doesn't mean that we immediately treat every patient surgically. There are specific indications when to attempt a surgical treatment of hemorrhoids. So for example, this which you can see here is a prolapsed internal hemorrhoid. It is prone to ulcers, bleeding, and progression, and that might be an indication to treat it surgically. Non-prolapsing internal hemorrhoids might cause bleeding and also anemia through this bleeding, and therefore that might also be an indication to treat them surgically. Adhering to the recommendations by the relevant medical societies can not only help us cure hemorrhoids, but it can also reduce frustration that patients feel and experience when suffering from hemorrhoids. Finally, now I can talk about the fourth thing I wanted to highlight. And the fourth thing is something that a clinician or a doctor who's treating the patient not only can do, but should do. Many dangerous conditions, such as cancers or Crohn's disease, can cause similar symptoms, and this is where a doctor has an opportunity again to show his skills and knowledge and to identify a possible lethal condition of which patient himself is maybe not aware of. There are specific signs and symptoms which indicate, for example, a presence of a malignant cancer, and a skilled doctor should be able to recognize them. We all can benefit from this video. If you're a doctor and you want to make videos like these, then go to Symptomsky.com. But if you want to know more about hemorrhoids, and if you have questions about hemorrhoids, then go to Symptomsky.com/help/hemorrhoids.